Hello, everyone. Welcome to the Complementary Wellness Therapies panel. My name is Tré LaRosa, and I'm an adult with cystic fibrosis. I'm also a scientist and a writer, and I'm really passionate about clinical research and science. I'll give you more of a background in a little bit, but I will be moderating the session today. Before I introduce our other wonderful speakers, I wanted to provide a few housekeeping items. The session is being recorded and will be available to all registrants after the event on the CF Foundation YouTube channel. You will be notified by email when session recordings are available. We'll be taking audience questions during the session, and we encourage you to submit questions at any time into the Q&A box. We really want this to be a fun, lively, engaging panel. We don't necessarily want it to just be myself, Julie, and Johnny just talking. We want to have some engagement with the audience, and we'll also be doing some polls and vote other ways of engaging with the audience as well. So we'll do our best to answer as many questions as possible during the conversation, but if we can't get to every question, we'd love to answer these over email or have further dialogue after the session concludes. As a reminder, this panel discussion is not intended to be a substitute for medical advice, diagnosis, or treatment recommendations. Do not make any changes to your own treatment plan without first consulting your care team. We're going to talk about a lot of really important things, but we also want to recognize that we're not here to tell anybody what they should do or that anything is definitive. We're really expressing our personal experiences, and we hope this encourages others to be, engaged with their own care and to empower themselves, but to also empower themselves to have good conversations with their care team. If you have any technology problems during the session, please visit the help desk. So I mentioned a little bit about myself. I'll give a further intro now. We'll go ahead and share the slides, and then I'll allow Julie and Johnny to introduce themselves. So my name is Tré LaRosa. I'm an adult with cystic fibrosis. I'm 28 years old. I'll be 29 in just a couple months, which is particularly interesting because you'll see a lot of photos of my sister on here, and she died in 2018 on March 12th. So we're actually coming up on her the 5-year anniversary of her passing, which is a really weird kind of moment thinking about what's happened in my life since, and also partially why I'm so passionate about the subject today. Alyssa also, she was 29 when she died, so it's very interesting to me to be reaching that age myself. I'm also, you'll see, I a couple years ago I went and spoke at the headquarters of the CF Foundation. That was a really big honor. My parents got to come, some of my family got to come, and I got to speak with. Speak and answer questions, and my dad was answering questions at some points. It was really cool. You'll also see Duncan on here, and I lived in Pensacola for a year, and I tried to surf. Didn't get up on a lot of waves, but I did succeed a couple times, and that to me was very cool. I'll talk a little bit about that during the exercise portion. But if you could go ahead and advance. Oh, I can advance the slides actually. All right. I am just really passionate about advocacy and science, and I have a lot of hobbies. I enjoy hiking. Most notably with Duncan, and I'm just really close with my family and really passionate about sharing my story and sharing my sister's story and advancing outcomes in the right direction. So I'm just really happy to be here today, and I'll hand it over to Julie. Julie, I'll switch to your slide now.
Thanks, Tré. Hi, everyone. I'm Julie Desch. I'm 62 years old. And that's a long time, y'all. That's a long time to live with 2 copies of Delta F508. I've lived through so many different transitions in CF care. In the upper left part of this screen, you'll see me at I think this was about 10 years ago, but I'm not exactly sure. I know that I'm wearing the same pants, so it can't be that long. And then you'll see me as like a wee one, maybe 3 years old or so, standing in front of the first house I can remember. And the other 2 black and white photos here are of my siblings who also had CF and who have also passed away. There was something going on in our genome that they're called modifier genes that was probably happening because without any care other than IV gentamicin and other poisonous toxins that killed bacteria, that was the only thing available for CF care for my older brother and sister, Kathy and Tom. So they lived a very different life than I'm living now. Kathy died when she was 31, and Tom died when he was 58. So you can see right there, like, when Kathy was 31, I mean, that was 1984. That was a long time ago. So she lived really a long time given her genome. And Tom, I mean, living to age 58, and he was 11 years older than me. So there's something in our genome. I lucked out. And I even doubly lucked out because I was born last. So I've been able to be here for all of the things that have developed in CF care, for Pulmozyme, and now Trikafta. All of that stuff has kept me alive. And I'm just so grateful to be here. There are a couple of passions in my life. One of them was exercise. And I feel like that's the thing that has, other than, a lucky modifier gene or two, that's the thing that kind of kept me going. I've been a passionate, almost addict of exercise my entire life. And that's what, I think that and my love for my older brother and sister were what kept me going. At some point in my life, it was probably when I moved out to California and Kathy died. I was with her when she died. And something happened during that process that just put me on this path that I've been on ever since then, a spiritual path. That's what led me to meditation, and that's what I want to talk about a lot today later. But before I get to that, I want to introduce you to my family. So in my upper right-hand corner is my partner, Barb, with me in Hawaii, I believe. You'll see a whole bunch of dogs on a couch. 3 of those dogs are still with us. At one point, we had 6. We are total dog fanatics. And then the entire bottom half of this screen is devoted to my 2 kids, who are the love of my life. They're 24 and 25 years old now, and they just keep me laughing. They keep me going. They've always been my motivation to keep pushing through whatever CF put in my way. And then the final thing, the little kid over in the corner that says, "Relax, nothing is under control." That kind of speaks a little bit to my passion for meditation. I started meditating probably 30 years ago, and it has led me to this place where I am now, where I'm happier than I've ever been in my entire life. And I owe it all to that. That's all.
That's perfect, Julie. I can't wait until we get a chance to dig in deeper to meditation and exercise. Thank you for sharing. And Johnny, I'll hand it over to you.
That was beautiful, Julie, and Tré. So good afternoon, everyone. My name is Johnny Grant. I am the adult cystic fibrosis pharmacist at Johns Hopkins. I've been in this position for, this will be year 8 or 7. I lose count now, but I love it. I love helping people. I love tackling all the insurance and pharmacy issues and stuff, and making things smooth and accessible for the patients and the care teams and their families. And it's just been a heck of a ride. So I have some pictures here of a little bit about me in my life. And so in my life right now, a huge part of that is my family. I have a young family. My son is 10 months. His name is Grayson. And my daughter is 3. She'll be 4 in May. And they consume a large chunk of my life right now. So I have a lot of pictures of them and my beautiful wife, Ariane. We've been married for about 7 years. And so I also share some pictures here. I love playing basketball. And so I don't get to do that as much anymore. But I love to play. I feel so free when I play. And I have some pictures of just family activities. So we were picking some apples, and we try and do fun things together. And even cooking. So we were making a homemade pizza here in the middle. And then I also have a picture of me hiking. This was me this past fall in California for my friend's bachelor party. We hiked up the Hollywood sign in Los Angeles. So that was fun. That was a lot of work, but that was fun. And then the bottom right is a picture of me and Marsha, who's our CF nutritionist, and we were doing a community service event in the fall at the First Fruits Farm, and we harvested like 700 pounds of cabbage. It was so much fun. And so I have a machete in my hand in that picture, and like it was like just the most awesome experience. Like I just love to chop the cabbage. So that's it for me. But it's a pleasure to be here. It's an honor to be here and to represent for the care teams.
Thank you, Johnny. That's perfect. Really, really enjoy it. It's cool. We were working on a session together last year when right after, I think it was right after your son was born. So this is really cool to be here with you again. So, all right. So we want to make sure that we get you all a little engaged. So we have a couple questions for the audience to really before the beginning of the discussion and also to guide the discussion a little bit. So go ahead and go to the Vote Now tab and answer the questions by clicking Vote Now on the right side of your screen, and we invite all audience members to participate. So we'll give you a little bit of time to do that. And we'll have the answers sort of pop up on the screen as you guys answer it. What do you think of when you hear alternative and complementary therapies is the first question. Julie and I will definitely get into this. I'll just sort of, I don't want to plant any seeds yet, but I also don't want there to be silence. What do you think of when you hear alternative and complementary therapies? Let's see.
Maybe there's no one there.
Maybe people aren't filling it out. It looks like people might not be. If not, we still have stuff. Oh, there we go. Cool.
I think it's a little bit of a delay.
Yeah.
Good.
There we go. We got supplements, meditation. Will it even help me? That's a really interesting one.
Mm-hmm.
And a good question. More work? Okay.
More work?
So what I tend to think of when I think of alternative and complementary therapies is I tend to think of anything that is not necessarily prescribed and approved by insurance, mainly because I think of that as things that can help us that aren't, defined as being like indicated to help one specific thing. And so I really don't necessarily think of it as anything other than the parts of our health that we do in addition to the very specific stuff prescribed for CF. But I think that's challenging because I think with things like exercise, like there's a lot of evidence that exercise helps a lot of things, but saying like, is it going to directly improve your FEV1 in the same way a modulator might? It might, but it might not be in the same exact way. It might also be more profound and more systemic in improving your mental health and things like that. So Julie and Johnny, what do you guys think of when you hear of alternative and complementary therapies?
I also think of things that are not pills or respiratory treatments, things that are not necessarily produced by a pharmaceutical company, things that are not prescribed. Exactly, Tré. That's generally what I think of. How about you, Johnny?
Yeah, and for me, I would say, or I would think of these as the things outside of the traditional. Here's what we're going to prescribe or do because we have extensive research or like in medicine. So like research, evidence-based recommendations, and so things that are outside of that. That's what I would think fits into the alternative and the complementary therapies.
The thing that I think is really interesting is like one of the medications that is a part of mostly every person with CF's treatment regimen is hypertonic saline. But the history of hypertonic saline is people were found to fare better on the Gold Coast of Australia, and that's just salt in the air. And that to me, prior to getting indicated for something that helps with CF, that would be pretty within the bounds of alternative and complementary therapies. Probably started with people, not that anecdotal evidence is ever enough to really push something as definitive, but it probably started off with people saying, like, they felt better when they were at the beach. And, I think that that's super interesting and relevant to our conversation today. I think that there's a lot here that I really think we'll touch on. So I really appreciate this. Do we also have the ranking question?
There we go.
Okay, so right now we have THC CBD is ranked at number 1. Those are the 2 most well-known cannabinoids in weed. And then we have meditation, exercise, acupuncture, vitamins, and supplements. So this is perfect. I'm just going to mark, so we got THC, meditation, and then exercise. So what we'll start with is we'll start with cannabis, and I'll briefly talk about it's fluctuating. Well, we'll still start with cannabis because that's what it started as. We'll get into meditation for sure. That's going to be the meditation exercise is definitely going to be prioritized. So I'll just briefly talk about my experience with medical marijuana. I got a medical marijuana. I've struggled with sleep, anxiety, and depression for many, many years. As I've grown older, I've realized that sleep has been one of the biggest detriments in my life for as long as I can remember. I was not good at sleeping ever, even in middle school, high school. And so when I got the opportunity to look into medical marijuana, I embraced it, and I got a medical marijuana license. And in my journey with using medical marijuana, I would often have honest conversations with my care team. I'd have honest conversations with my social worker who was acting as a therapist at the time. And what I learned is that I had prior experience with anxiolytics, including Xanax, and SSRIs, including Zoloft. And those had both helped, but a lot of it was in the aftermath of losing my sister, which was of course, profoundly life-altering experience. But it wasn't something that, like, my sister's death was not, like, it was sort of a natural extension of so much of Alyssa's health issues and my relationship with my sister. And so for me, I felt that without a fully regimented, going through the difficult, it's very difficult to navigate a mental health, care regimen. Everybody has different things that work for them. There's cognitive behavioral therapy that works really well for a lot of people. Antidepressants resolve some people's depression. But for me, it was definitely a much deeper thing that really required me to process a lot of my life. And that was hard to do I started developing panic attacks, and I realized that the Xanax would stifle the pit in my stomach, but there was still this bubbling anxiety in the background that I didn't know really how to confront. And so for me, what medical marijuana offered was a much better way for me to process the amount of stuff that I had been thinking about for years and years, including a lot of guilt and a lot of struggles that I had with my sister's health and my own identity. And for me, that was really hard to access through just traditional SSRIs. And sometimes talking helps, but oftentimes I feel like I talk just to fill the space. And so sometimes I'll feel like I'm just talking to rationalize or think through things. And sometimes I really just want to sit with an emotion and try to think about things. And that's what medical marijuana offered for me. And I noticed that my anxiety started to really, really go away, not just whenever I'd eat an edible or whatever. I use tinctures as well, put them under my tongue. But really the day after, I realized that I had actually, the way I think of mental health is, I think of it very similarly, and this is a good segue to when we talk about exercise, Julie, but with exercising, if you want to look like Arnold Schwarzenegger someday, you have to start small. You have to start with lighter weights, and it takes time, and you have to really do a lot to get there. And with mental health, I think a lot of times people think of depression or anxiety as this binary, as one day you're depressed, the next you're not, or you're depressed and then you just wake up one day and you're not. And it's a lot it's a lot more of a spectrum than that. And for me, I realized that so much of what I needed to process was incremental, which was really hard to access with SSRIs, which were, maybe repleting some serotonin in my brain, but I wasn't actually processing stuff that I'd been thinking about for a long time. And for me, there is a spirituality element to this, because I realized that for me to feel, for me to accept my sister's death, I had to forgive myself for thinking about my sister. I felt like I was prepared for my sister's death. And I really was, because I had thought about it for a long time. But I realized then that me thinking about it was an extension of my love. And I realized that that was really hard for me to work through without having, whether it wasn't the medical marijuana that pushed me through, I don't necessarily know if it was that alone, but it was what allowed me to pull the guardrails down. So for me, I just had a really big benefit from that. And I think it's really crucial with something like medical marijuana to have open conversations with your care team. But that's not easy for everybody. A lot of people either don't feel comfortable sharing that, don't feel comfortable admitting it, don't feel comfortable having this conversation because they know the immediate response might be, well, don't smoke it. And it's like that. I think that it's, of course, it's an important conversation to have, but I do think that patients need to be given the autonomy to educate their doctors on what works for them, and being told exactly what to do is we've all dealt with this for a long time. We know what we have to feel like we have some control of our life and our health. So yeah, that's really mainly the big things I wanted to talk about with cannabis. I don't know if Julie or Johnny, you had any comments or if there are any questions.
If I could piggyback off of just one thing that you said about discussing it with the care team, I 120% agree with you. I think that's so important. It's important for your care team to know what's going on or what you're doing, so we can partner with you.
Right.
And it can also help us as well, as we're managing you clinically. If there is anything that is off or that is unexplained, that can also help us. And so, yes, we as your care team are going to recommend that you do not inhale it or smoke it, most likely. But in terms of edibles or the tincture that you're doing, I'm okay with that. I'm try it, and if it helps you, it's great. And if not, then reassess. But we just don't have the evidence for us to formally recommend it per se.
Right.
At this time, there's a lot that is out there, but from a safety perspective as well, it's a good thing for us to know, because some people can have elevated liver enzymes from
Right.
cannabis or CBD use, and we may see that happen and think, "Oh, is this from Trikafta? Is this from something else, or something that's going on?" And if we don't know that that's something that you're doing, we may take something off or away that's unnecessary that may actually be helping you. And so, yeah, it's important that we partner with each other, even if we don't necessarily recommend it or it's not within our traditional scope of things. But that partnership is key. So I just wanted to share that.
If I might add one more quick thing right before Julie and Johnny, I think the other important thing, at least from my perspective, is that if care teams aren't aware of it being used, or that patients are wanting to know more about it, or are you anecdotal evidence is not what gets a medication approved or indicated for something, but anecdotal evidence it helps to understand how people are filling gaps in their life. And so at the very least, it also helps care teams to understand the more nuanced experiences of patients that can hopefully normalize it. And then eventually, ideally, in my view, we'll see clinical trials that get into how cannabis could potentially be a promising anti-inflammatory. We do have a question, but right before I ask that, Julie, I wanted to see if you had anything you wanted to share.
There's just so much. So I've used cannabis. The most significant time I used it, and always edible, of course, was post-surgery. I had back surgery, back fusion surgery, and it was a very important part of my pain control and my ability to sleep at night. I didn't want to take oxycodone. I didn't want to have to take the oxy. As very much. And it really helped me to add in THC instead of just, popping oxy. It really helped me get through that period with less pain and with an ability to sleep. Now, we're body, mind, spirit organisms. And since then, I sometimes will take a 5 milligram THC gummy at night to help with sleep. And sometimes because it connects, it kind of does the mind-body connection thing, and it becomes spirit. And it's just, it's so important sometimes for me to be able to feel that connection and to really understand on a deeper level what it is that I am in essence, not just this body and definitely not just this mind, because sometimes this mind is crazy, but I'm so much more than that and so much beyond that. And the THC sometimes gets me in that place, that sweet zone, where I just see it very clearly. And that's worth gold to me.
I'll add on to that just after I ask. We do have a question. Somebody asked you, Johnny, what about the concurrent use of CBD with psych meds?
Yeah, so that's one I would. So one depends on which psych meds that we're on and that we're talking about as well, to see how they interact and what's going on. But I would have a level of I don't know if concern is the word, but I would want to be on alert there, because we know that THC and CBD is psychoactive in ways that we're still learning about, and so we don't necessarily know. And so it's one of those things where, again, if from a safety perspective, it appears safe, there are no known drug interactions or no concerns, that maybe we try it. And it's one of those things as well that we would likely recommend that you start low and go slow in terms of your dose and increasing and stuff, because you don't know how your body's gonna react with your psych meds or your other meds and stuff as well. So that would be my thing. But I would definitely recommend bringing that up before starting it and talking that over with your care team or your psychiatrist if you have one.
And on that note, Johnny, I maybe should have made this more firm, but for me, it wasn't that I was on SSRIs and anxiolytics when I started. When I got my medical marijuana license, I'd actually come off them at that point by my own choice for a variety of reasons. But I really don't think it has to be an all or nothing. I definitely don't want to emphasize this idea that if you're struggling with depression and anxiety and SSRIs aren't working, that medical marijuana will be the curative approach. It's more that I want to express that a deeper perspective of mental health, and that mental health is usually not just in my view, it's not just an imbalance of the right neurochemistry in my mind. It's a lot more situational. I often call depression a condition of conditions. If my life were identical in July versus January, I can assure you that how I respond to those situations will be very much different, because if it's July and it's 7 p.m. and I can take my dog to the park, I will definitely be processing a stressful day a lot better than if it's 7 p.m., it's pitch black out and it's 30 degrees. That for me is and again, it's more to emphasize that I think for me, medical marijuana helped me realize those things that affected my depression on a much deeper level.
There is no one size fits all. And I think that's the key takeaway here. And at the end of the day, you have to find out what works best for you, and how your body works, and your mind, body, and spirit, as Julie was saying. And I think that is so key.
And I think that everything we talk about, meditation, exercise, and cannabis, there's a spiritual component for all of us here. Julie and I have talked about this a lot on our planning sessions, and that then goes into a perfect segue. Our next topic we'll discuss is meditation. I'll briefly just share. I am a prominent. I love meditation. Huge advocate. for me, it's still challenging. It's a skill, and I have learned that if I don't pick something up right away, it's hard. I end up with a bruised ego, and so with meditation being a thing that I know could have even more profound benefits for me, it's a challenge, and I have a hard time shutting off my mind, which is all the more reason why I wish I could meditate better. But it's a great thing, and I want to hand it over to Julie to talk about her advocacy and experience with meditation.
Well, one thing I want to say right off the bat is meditation is not turning off your mind. That's like the biggest, it's like the biggest challenge, because almost everybody who's not had experience meditating before, if they try it, they're going to say, I can't do this. My mind just goes on and I can't stop it. And no, you can't stop it. That's like the first insight that you have when you try to meditate is it's impossible to stop the mind. It's a conditioned habit of the brain. Like the brain secretes thoughts the way, your pancreas is supposed to secrete enzymes. That's what it does. And the idea of meditation is to learn how to see that very clearly and not believe it, not believe your thoughts. Because once you get the skill of being able to see your thoughts and not believe them, you will not believe the happiness you can find, because you're able to just drop all of those things that you thought you had to do. Like you have to achieve all these goals. You have to get healthy. You have to do X, Y, Z, like blah, 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 all day long, when you can see very clearly that that's just a habit your mind is telling you.
Yeah.
It's just amazing that you get to drop that load. I started meditating, like I said, about 30, maybe 40 years ago. I don't know. It was forever ago. And with MBSR. And
what is that? MBSR?
Stress reduction. Yeah, I was working a long time ago, working as a physician, new pathologist, and I was like overwhelmed, and I didn't think I knew anything. I didn't know why I was there. I was such a poser and just totally stressed out. And I learned how to meditate. I learned how to do mindfulness, right? Which is just basically following your breath, following your thoughts, following your feelings, your emotions, just watching them. And that was just a really useful, very useful skill to develop. And, at first it just showed me that, hey, I could actually learn to relax.
Yeah.
And just kind of let go of a lot of tension in the body. That was a huge skill to develop. So I couldn't be more of a proponent of learning to be okay with whatever's happening in here.
Do you think that you would have been like, do you think that because to me, whenever I meditate, I often focus on my breathing. And then I realize that whenever I think about my breathing, I realize my cadence is not, I don't understand how I breathe naturally because whenever I try to think about my breathing, I feel like I don't know how to breathe.
It's like you try to take control of it.
Yeah.
And breathing is maybe not the first thing to focus on if you have CF when you're trying to meditate, learn to meditate, because that can immediately put you in a state of anxiety. So instead, if you want to focus on the breath at all, I recommend focusing just on how the belly moves, just feeling the sensations of the belly moving, not thinking about the lungs or the breath or anything at all. Or just focus on sensations of the body. Like that's where the goal is, because that's always present. It's always right now. You can always find sensations. They're always there. You can just feel the sensations of your feet on the ground or your butt in the chair. It's always present, and it's always now, and it's not anxious.
And as a reminder, folks, you can just submit questions during at any point. So just want to mention that. But yeah, Julie, the thing I always think about when I focus on breathing, I usually try to meditate when I'm going to sleep, because as I mentioned, I have a hard time falling asleep. And that's when I always like fixate on my breathing. And then I'm like scared that if I fall asleep, I'm going to like, not like, it's not going to kick in. Yeah. It's something I like, but I do think for me, part of the meditative aspect is like wanting, I think that with CF, there's this desire to have control over our bodies because a genetic quirk has radically altered so many of our lives. So I think for me, there is a spiritual kind of component to having, whether or not, to your point, the focus on breathing might not be ideal for people with CF, but for me, it's like anything that I can have control over my body that usually seems like out of control. So some degree of control over my mind, I think is really important to me. Do you feel like that's been consistent for you too?
Well, I would just say after a few decades of experience meditating, I think the thing that it showed me that is true, I'm not in control of anything, and I never have been. Like, if you really get that point, like the body is doing its own thing without me. I'm not steering this ship. I don't steer the thoughts that are happening in my mind. They just arise. I don't steer the sensations. I'm not in control of anything. And once you really get that, and I don't mean intellectually, I mean that in like a physical insight, you really get it. There's such a huge relief because it's like, oh, wow, I can just relax, let life happen, let life live me, because that's really what's been happening this whole time.
And this is perfect because James Lawler, what's up, James, said he took an MBSR class that you led through CFRI, and that's perfect because Ali also shared your monthly mindfulness session. So this is great. Hopefully you'll get some people there that will show up next time. And Ed, I appreciate you sharing that article. Ed Kanda shared an article that he had written for CF Roundtable on CF meditation and wellness. So we'll definitely have to share that. I'm looking forward to reading it. Johnny, we actually got another question come in about CBD THC. And this is a really important question. And this is exactly why I emphasize telling your care team is somebody asked, are there particular concerns when it comes to CBT/THC affecting the CYP enzymes that metabolize a lot of the pharmaceuticals we encounter with CF?
Yep. So that's a great question. Thank you for sharing that. And so the short answer is possibly. It's not totally clear theoretically, and there have been some case reports that have shown that it may be a CYP inhibitor, which means that it may increase the levels of medications that are metabolized by the CYP enzymes, which Trikafta and Kalydeco are those that could be affected by it. And then there have also been some reports about increases in the liver enzymes as well. And so, but the amount and what we know is still fairly small. And I also know from practice as well, because I have patients who are honest with me and let me know that they are doing CBD or marijuana, and they are on other therapies, and we just monitor them and we see, are we seeing any abnormalities? Are we seeing anything? And in some instances, we have had to make adjustments, and in some we have not. And so, but there's a lot of variability in terms of how much they're taking, what they're doing, how often they are actually doing it. And so there are a lot of moving parts there. So a short answer would be yes, possibly. But I've also seen it where there has not been a major effect on the health of a patient who's on meds that are metabolized by CYP enzymes. So it's a maybe answer.
And sort of underscore both two themes that we're trying to emphasize here, which is one, having honest, good conversations about this with your care team, and then secondly, the importance for increased research is that cannabis use has actually been shown to be associated with reduced prevalence of progressive stages of alcoholic liver disease. And now I don't want to emphasize that doesn't mean that you should try to treat alcohol-induced liver disease with cannabis, but it goes to show you that it's really, really difficult to think that there's any definitive answers to anything in medicine is just it's quite honestly naive. Yeah, and so but it's important because it's all about risk mitigation, and I think that this was a huge theme of COVID. That's something that the CF community deeply and community. I use the term CF community to include our families, our care teams, the CF Foundation, CF Roundtable, like everybody that truly like interfaces with people with CF. But we understood risk mitigation really well. The CF community was pretty quick to uptake masks because it's just naturally, So I think that that point just sort of underscores that there's still a lot to learn about cannabis. And also one other thing is we've been kind of talking about THC and CBD, but in cannabis there can be there are tons of compounds called terpenes and flavonoids, which also might have therapeutic benefits. So there's a lot of complicating factors, which only underscores the importance of more clinical research.
Yeah, we all are learning, and as we learn more about it, then that can help to inform our decisions as we move and we go forward. So that's why it's important that we do research. That's why it's important that we're honest about what we're doing, and so that we can get more data. Even what we have on the theoretical interactions and things that we have, that's on very limited data. And so like I can't fully hang my hat on it, but something limited is better than nothing at all. And so and that's a whole nother conversation as well about like how do you evaluate the safety or like the efficacy of these things as well. That's a whole nother topic too.
And at the beginning of the call, Julie had expressed, and this was actually really consistent to my story as well, how her siblings had fared fairly well prior to a lot of medications. And that is something that my sister and I were in the same environment, cultured the same bacteria. She being a female, me being a male, definitely plays a role into health outcomes, but just a lot of different factors. My sister was 5 years older, and she probably spent 30 to 40. My dad and I did the math one year. She probably did like 30 to 40% of her life, if not more, in the hospital, whereas I've been hospitalized fewer than 10 times. And I've responded well to every medication I've ever taken. And I've just been very fortunate in that way. And so I think just like how siblings can have much different outcomes, people respond differently to different medications. We've seen this with Trikafta and other modulators. Some people develop hepatotoxicity, others don't. And, I wish it were a simpler answer, but it's not. And so I think it's just these conversations are what move the needle. So the next topic is exercise. And so this is to sort of follow up. Julie mentioned her passion for exercise at the beginning. I love exercising, but I tend to exercise more consistently when there's a competitive aspect. Johnny and I are going to play pickup basketball sometime soon. So, but I love basketball, and I can go run for 3 hours if I go play basketball. And if I go for a jog, like 20 minutes, and I'm like, my back's locked up. I'm like, why am I doing this? And there's no competitive aspect. And I've been trying to turn a competitive, ever since we started planning this, I've been trying to turn a competitive aspect into turn exercise into that again. But for me, exercise, when I was growing up, anytime my FEV1 would drop by 3% or whatever, I just like immediately ratchet up my workout regimen, would play basketball more, would lift more, would do so much more, and really get committed to it. And for me, it gave me something to strive for at a very young age, and it taught me discipline, in a discipline that I sort of lost over the years. I sort of, got busier with other things. I went to college. There were a lot of other responsibilities and obligations, and I still loved exercising, but unless I went and played basketball, it was really hard for me. I'd go to the gym, and much like I said with meditation, I couldn't, even with exercise, which Johnny, you said you felt free when you play basketball. For me, if I'm playing basketball, I cannot think about any of the stuff I was stressed out about before when I walked in there. And because, the second you start thinking about that, someone's blowing right by you. And so, I have, for me, it was a very, very exciting thing to have something to work towards. And it was something that I felt like it was a lever that I could control, right? It was a lever where if my lung function was down or whatever, I had an infection or whatever, I could shift that up and like try to do that to take control of my health. And so that was something that I was really disciplined about. And then I got older, and in recent years, I just still, it's hard. You have a stressful day, and it's hard to not be tired. And but I've been trying to get back into it. And for me, exercise has been something that I try to cling to whenever and then when I'm consistent about it, I like am reminded how good it feels. So, Julie, I want to hear more about your history with exercise.
Well, first of all, I played basketball too. I started when I was like in elementary school, and we have a team here almost.
Yeah,
I was a point guard, and like on the high school basketball team, which won the Nebraska State High School championship. I sat the bench at this point, but they called me Woodstock. I was so little. I was like the littlest one on the team, and my nickname was Woodstock. You know, the Peanuts character? I have a tattoo of Woodstock because of this.
Oh, that's awesome.
Yeah, basketball.
That's cool.
When I really became addicted, passionate, whatever, when it really grabbed me was when I started lifting weights. I was about 20 years old, 21 maybe. I started lifting weights, and we had a bench and some dumbbells and a bar in the basement. I started lifting weights, and I got this book, this bodybuilding book, female, I can't think of her name. Anyway, I started to do her program, and like within a month, I noticed a difference with the way that my shirt fit. Yeah. And I was just like, oh my God, you mean I have a little bit of control over this body? Like, that's what did it for me. It was like, CF doesn't touch this. CF doesn't care. I mean, it doesn't, weightlifting doesn't care that I have CF. My muscles respond to the stimulus of resistance in a normal fashion. And I mean, that's all it took. Then I started going to a gym in order to have like a greater variety of things I could play with. It was like a playground. But then I also got into cardio because I realized way back then that cardio was so important for my mental health. Like, I just knew at some intuitive level that if I pushed myself really hard before work, I would go to the gym before. This was when I was in training as a resident. I would go to the gym before. And even during medical school, somehow every day I managed to get to a place where I could exercise, because I knew that if I did that, my mind was so much clearer. I wasn't as anxious. I wasn't as depressed. Mm-hmm. And I mean, that's what kind of, like, those two things, the fact that my muscles responded and the fact that my mind responded, those were the two things that kept me so passionate about it that I became, like, when I retired in order to stay alive when we had babies, I was so passionate about this that I got personal training certificates, and decided that I was going to start coaching, wellness coaching, and write exercise regimens for people with CF and help them get into it and do it, because I knew how important it was for all kinds of benefits, for all kinds of reasons. And I did that for quite a while.
Yeah, it's awesome. We got a couple of comments in the chat talking about like the difficulty with like getting motivated for exercise. Something that this is why I think exercise fits within this sort of alternative and complementary therapies, therapies sort of space, is because, like, yeah, I mean, we know there's plenty of peer-reviewed evidence that show the benefits of exercise, but it's hard to prescribe exercise. And with CF, everybody has like the burden of care for CF for so many years, and for so many people still to this day, even in the modulator era, is a lot. It's hours a day. It's pain. It's chronic coughing. And then in the COVID era, it's concern about getting other infections. It's really not easy. And I think that I think that exercise is a skill too. And it's like something that if you don't know where to start, it's really hard to start. And if your doctor or your care team tells you that you should exercise more, it's like if you haven't ever, like, there's also the idea of going to some gyms are not welcoming to people who are learning how to exercise. And, you know, and if you want to run, it's still a skill. So I think that a big part of it, and I think that's why you wrote the regimens, is because it's to help people sort of get into it and develop it and get better at it. So I think we also got a couple comments of people talking about when they were younger, they were a kid, they were told not to join sports or activities, which, you know, makes sense. Exposure to pathogens and other people. And so I think that's interesting. A lot of what we deal with is stuff that we've dealt with since we were very young. So those are really interesting.
It's definitely a fine balance. There are risks to everything we do, but there's also benefits to everything we do. And the balance depends on who you are, what your risk factors are, how old you are, you know, what bacteria happen to be growing in your lungs. The risk factors change based on what the body is that you happen to be living in. So, you know, there's no one rule. But in terms of motivation, the thing, you know, I learned how to talk to people about motivation and how to do appreciative inquiry when you're coaching someone. And the thing to do is find what you love. Like for you guys, it's basketball. Find what you love to do. For me, it was like lifting weights and watching my body change. And then just do a little bit so that every session, you come out of that session of exercising feeling better than you did when you started. And that may mean a walk around the block for some people. And that's okay. That's okay, because you dip your toe in and then you get used to it and it gets easier and easier. And it's not always easy. That's for sure. And with CF, it's like a sine wave, you know? Yeah. If you get sick, you got to start over at the very bottom. And that sucks. But that's just the way it is. You always improve.
Go ahead, Johnny. Go ahead.
That's so good. As you guys are talking about this, it's also helps me a lot as well, because it's about building those skills, and whether you're strengthening your body through exercise or your mind through meditation, it really is skills and it's practice. And when I meditate and I'm focusing on my belly, on my breathing, and I forget and I drift and I come back, every time I do that, my mind is getting stronger so that I can focus more on it next time. And then same with like basketball or whatever. Like I may be winded the first day, but like if I stick at it and do my baby steps and stick with it, is the thing. So I think and I know overall there are rewards to both, and just a matter of just like sticking with it. You know? Yeah,
and earlier today I went to the gym and I was like realized that I probably could have used. I was pretty sore and I've run a good amount this week, and I realized today would be a good rest day. But I was already at the gym and I was like, this will give me a perfect story for later today if I push through and do. I don't lift legs as much as I should. I inherited that. My dad and I are both Italian men, and we don't work out, lift our legs as much as we should. So. But I realized it'd be a good story. And also, one other side thing I want to say about exercise is like whey protein and creatine are like two of the most well-documented supplements that have been shown to really, really help with building muscle. And really it comes down to like, if you just drink whey protein and never work out, you're not going to get like more muscular. But if you drink protein after you work out, you'll get more muscular than if you worked out and didn't drink protein. So I think it really sort of serves this idea of the holistic component, which I think is really the at least my view of the thesis of this, is that if you exercise, meditate, and whatever else, you're not necessarily going to be dramatically healthier. But if you do those things consistently and do those as part of your overall health regimen, you'll likely be healthier.
And if I could share one more thing on that as well, is with the supplements and with those things, they're meant to be a supplement. I cannot stress how important your diet or like your holistic, like it's holistic. And so like don't depend on a supplement to change or rely everything. Like, it's meant to supplement everything else that you're doing. So your diet and stuff is crucial. And hydration is also crucial as well. So like sometimes I cringe a little bit when we talk about like the creatine and stuff, because I know that can be hard on your kidneys and stuff when you're not
Right. I know.
hydrating
Yeah.
and drinking and stuff. So
Yeah.
as my little side note.
Yeah, we got a comment from James talking about how he's been making some more time to exercise in the morning before he goes to work, and he said he's kind of mad at the fact that it feels good because he's not a morning person at heart. And James, that makes me laugh all the time, because one of the best things for me lately has just been trying to take like a midday walk. Like when the sun's setting at 5, it's getting better now, but when the sun's setting earlier, just getting out and taking a walk, like a 15-minute walk in the afternoon, has been really like so simple and still such a benefit. It's felt really great. So, but Johnny, to your point on your what you were just expressing is this sort of that we've talked a lot about being honest and open with your care team, and I don't think it's easy for everybody. So I'll just share a little bit about how it's been for me. For me, my thing has always been I'm really passionate about patient empowerment, but I'm also really passionate about recognizing that the CF doctors that I've had over the years, I've been very privileged and had superb doctors my entire life, but they've always been very good about wanting to hear my opinion. And I think I've always been, I've always really respected their expertise. I knew that they knew the world really, really well. But they've always, I've also emphasized, things that I want to try. And I usually try to present some degree of a case, not that has to be, but I just noticed that if I come to an appointment with an idea for something and express the risks that I am aware of, and that it's been good, it's usually been good, and the care teams recognize that. But I'm not naive enough to think that everybody has had that experience. So Julie, if you want to share like sort of your experience with partnering with your care team, and then Johnny will close. We'll end with you sharing sort of what your advice would be for how patients can best present the sort of complementary alternative ideas to their care team.
Yeah, I've never really had any issues being honest with what I'm doing with my care team. I mean, I've always felt like a partner, and it's probably partially because I come in as an MD and I'm treated as an MD by the MD. And sometimes like the social worker still calls me Dr. Desch, and I'm like, will you please not call me that? So I'm like not your typical character. But, even I was a little hesitant to say, oh, I do this THC gummy thing at night, at first. But then, it's like, why should I do that? That's crazy. Like, it's no more mind altering than a glass of wine. And, nobody thinks twice or blinks at the fact of you saying, well, I have a glass of wine at night. So anyway, that was my initial hesitation, was like, well, it used to be illegal. So what? It's not now. Well, it's not for me. I don't know what state we all live in, but it just, I don't know. I'm not your average bear in this conversation, I guess.
And Johnny, right before the legality part is also like a huge issue, or it's like a huge point of it too, as well, as that's why people don't want to share. People are concerned that if they have it on their records, it might affect their eligibility for a transplant, or it might come back to their insurance, or there's a lot of concerns there's a lot of systemic barriers that make this not an easy conversation. So I think that it is crucial just to like emphasize that we recognize this is not something that everybody can do, or it's not super easy, which is why we're having this conversation. So Johnny, if you want to share your thoughts.
Yep. So I'll be brief as well, but Julie said the key word, and it's partner, and it's to partnership. As your care team, I really try and tell each of my patients, you are the pilot. Like, you're in the driver's seat. I'm just here to say, here's my recommendation. I would take a right at the light, but if you want to go straight, I'm in the passenger seat with you. So like, I'm gonna go with you. But so you have the power. You have the ultimate say so. And I would also encourage folks as well. Be honest. As your care team, as your pharmacist, I really want to listen more than I'm talking, because like when I say that I want to partner with you, I really care about what you're feeling, what you have to say, and what you want. And so it's not just me saying you should be doing this, or that. And when I see a med
Right.
list, I understand you are more than the med list that I'm looking at. Like, yes, this says that you should be doing this once a day or twice a day and all this stuff, but like life happens, and that's not what it always looks like. And so so my key takeaway is we are a partnership. You are the pilot, you are the driver. We're going to work together, but you are the ultimate say so.
One of the most important things I ever learned in college, I took a healthcare sociology class, and it was just on the focus of patient autonomy and physician paternalism. And it's like physicians are experts in what they are, but the best physicians often recognize that knowledge is dynamic. It's changing. We've learned a lot. The gut, the connection between the gut and the brain was not really well understood. It's still not really well understood, but it was like the first time anybody ever used gut-brain axis, I think in the journal, like in the literature, was like 2005. So it's still there's still so much that we're continuing to learn. And I think that the partnership aspect, the best doctors and care team members I've ever known have been ones that have said, like, what are your thoughts on this? How has this helped you? And I think those things are really, really crucial. So, but this has been amazing. I think this has gone really well. I hope people are enjoying it. We're at time, actually a little over time. So let me conclude. Thank you guys so much. Thank you, Julie. Thank you, Johnny. Really, really appreciate this. Was I think hopefully really helpful for people. There will be a recording. We will share our contact information in the chat if you want to connect to have follow-up questions. And thanks to all of you for your attention, for participating in BreatheCon 2023. And before we go, please take some time filling out the satisfaction question under the poll tab on the right-hand side of the screen. We'd love to know how you all felt about this session, and we want to always make sure that these events are continuously getting better. So now we're now moving to the next round of small group and panel discussions you can take part in. Thanks again for attending, and we'll see you all at the next sessions. Thanks, Johnny. Thanks,
guys.
Julie. And thanks to all our
Thank you so much.